Chelsea, welcome to the show. Thanks for joining us today.
Yeah, thanks for having me. I'm really excited.
Yeah, it has been a wonderful way to meet people and have authentic conversations. And we started this show during COVID, and this is a nice, memorable show for me. I just got my second vaccination shot, so we're going to share this moment together.
That's great. That's really exciting. That's great news.
Yeah, so I try to start the show with trying to get to a sense of how people survived last year. Tough year, right? How did you make your lemonade? So I'd love for you to share with the audience, what are the hacks that you did to be mindful, to work on self-awareness, or just get through those tough days of self-isolation?
That's a really good question. So the division that I work in at the Vermont Department of Health is the Division of Emergency Preparedness, Response, and Injury Prevention. And everyone in my division is specially trained in managing incidents and emergency response. So whenever there's an event such as COVID, everyone in my division, we're kind of the experts at setting up a response. So I actually haven't, unfortunately, had a lot of downtime since COVID started because the position that I was placed in is managing all of the operations, all the health operations for the state of Vermont for COVID. So in addition to my normal EMS data manager job, I'm also working sometimes up to 60 hours a week on just COVID response. And so I'm taking it day by day, and I know a lot of my coworkers are doing the same. And you sharing that you just got your vaccine, I got mine a couple months ago, and to me that sort of signified almost a light at the end of the tunnel for me. Like it gave me a little bit more hope that we're at a new phase in this response where the population is getting vaccinated, and hopefully we're going to start seeing cases decrease.
What I was saying, and I feel now that I have the vaccine, this is my second dosage, the emotions I have is I feel like springtime. That's what comes to mind. Springtime, where it's that new seasonality. It seems like the world is getting back together. I feel like it's spring. There's just this weird emotions I'm going through. I'm so proud of all the efforts that everyone did to get it this far. But springtime is what came to mind emotionally.
I like it. Yeah, absolutely.
And when you received your second dosage, did you try to start going out a little bit more? How has that been for you? Because you're one of the few people also, I'm starting to speak to that now, have gotten their second vaccination. And I'm going to take this off speaker. So I just didn't know, what has been your life like after the vaccination?
I feel like not a whole lot has changed in terms of the prevention efforts. So I'm still, and a lot of people who receive their vaccine are still following CDC guidance and wearing masks out in public. I think Vermont we're a state that's doing really, really well with managing COVID. And I think a lot of that has to do with not just the policies that are in place at the state level, but the attitudes of Vermonters in the state in general, because people are tired. There's pandemic fatigue. People want this to be done with. And so if that means getting vaccinated and continuing to follow CDC guidance and recommendations, which includes maintaining a 6-foot distance or wearing a mask or not socializing with other families who aren't vaccinated, getting tested if you have any symptoms. I think people are pretty tired of COVID and are really looking for an end.
Yeah, and I heard a new word. I did the exodus from San Francisco to Miami. Okay. So about 2 days ago, I was walking and there was walking into a hotel, and there was a few younger people walking in without masks. So I said, I think it's the hotel policy that everyone should wear masks. Mm-hmm. And I heard a new word, and I'm going to share the new word on today's podcast. They said, we're all vaxxed. I said, what? They said, yeah, we're vaxxed. I've never heard that word. We're vaxxed. Yeah. And it delighted me and angered me at the same time, because so much time went into getting the vaccinations and hours and hours, and the younger generation was like, yeah, we're vaxxed. It's like, no big deal. I just rolled out of bed and got vaxxed. Vaxxed. Yeah. Have you ever heard anyone use that as like, I vaxxed?
No, I haven't heard that term yet, but now I have.
We're vaxxed. And it was this, I mean, the reason why it delighted me is that there was like a lightheartedness that, things are getting better. But it was, I know the effort to get to that vaccination was Herculean. So I just was like, maybe I would have used a different word, vaxxed.
Yeah. And the other piece to this is, while I'm feeling optimistic and very hopeful now that people are getting vaccinated, but I also don't want to lose sight of the fact that there are variants circulating in the US. There's a few different variant COVID strains, and there's still a lot that we just don't know about them. And so part of my job is working with subject matter experts here at the health department and really thinking about what are some of the possible implications of variant strains that we just don't know a whole lot about yet, and that we're learning more about. And while I am optimistic and I am hopeful and I feel great now that I have been vaccinated, we also don't know how long the immunity from the vaccine lasts. And there's a lot of unknowns still. So for me, I still wear my mask when I'm out in public, or even when I'm around anytime I'm around other people, I'm wearing my mask, even though I am, as you said, the new term, vaxxed.
So I want to dig on another question here. So some you've heard these. There's always this great question I love to ask is like, what advice would you give your younger self? Right, that's a great question. What advice would you? And I would wonder, since what you've seen and experienced, unlike any other guest I've had on the data side plus the human side of what you've worked on, what advice would you give to yourself only a year ago? Like, looking back at where you are now and how you got through it, what advice would you give yourself, like literally a year ago, March, like right when things started to get shut down? What advice would you give?
Yeah, that's a really great question. So back in March, when we first activated the Health Operations Center and the State Emergency Operations Center, everyone was working like crazy. And I think a lot of us thought, similar to other emergency response that I've been involved in, that the level of work and the intensity of work would eventually start slowing down after a few months. So it was very easy, and it wasn't just me, but a lot of my colleagues as well. It's very easy to work 60, 70, 80-hour work weeks, thinking that, okay, this is emergency response right now, but in a few months, we're going to start going back to normal. And in reality, we haven't really gone back to normal. So I made it a point this year, at the start of the year, to be better about my work-life balance, because I was finding that it was the amount of work and the amount of time that I've been working has taken a real toll on my relationships, and because I'm spending so much time like in the office, and I'm trying to be better about, shutting my computer down at 9 o'clock instead of working until midnight, and spending more time with my 2-year-old son and my husband, and trying to be better about doing more self-care, like going to the gym, or just trying to connect with friends via Zoom. And I think if I could go back in time, that's what I would tell myself, to take a step back and practice some more self-care.
Thank you for sharing that. That is such a theme that I try to focus on, that I learned same during this time. I got back into journaling and self-awareness, self-reflection. And you're right. I hope everyone that listens finds that place of self-care. And I feel like I'm living my best self. Although there's a lot of sadness in the world, I just feel that all of that work, like you said, is just paying attention to it. I'm getting there. I'm happy you got there. I mean, that's the right advice that resonates with me on the advice.
Yeah, that's great.
Was stressing times. I mean, it was lots of unknowns. And when I've asked that question to other new guests, what's been interesting is a lot of people have went back to something creative. Maybe just the data science community is very creative. So a lot of people went back to playing an instrument, or painting, languaging, or cooking.
Yeah.
So everyone is trying to find these little nuggets, and it's great to listen to.
Yeah, I love that. I love that idea of picking up something creative to work on some self-care habits.
Yeah.
It's great.
And then the other trend I've heard is everyone's trying to stay away from the TV, the news. That's just another sense of like triggers and sense and stress. So I think that's been great. Now, as far as on the data and the team, I know you're at the office. Are you in that place now where everyone has to be back in the office? Do you think your work can get done half remote, half in the office? What for the data science or any other product?
Yeah, so most of my coworkers are actually working remotely. I personally find it easier to come into the office. There's less distractions for me. I know some people find it easier to work from home. I don't. So for me, it's a quick drive. It's only about 20 minutes to get here. And I find it easier to work here in the office.
There are people that I've had on the show that, although they work from home, they need to start with some type of commute. Some of them literally just like wake up and they just have to drive to get coffee.
Yeah.
They have to. There was something about starting the day, on showered, then I can start it. So I think it's amazing how everybody has just found their way. And there is no right or wrong, but everyone's finding their way. Now, as far as as the data science projects or findings that you're working on, anything you feel comfortable sharing with the community? We've been talking about a lot of things on mindfulness and health, but again, I'd love to have you talk about other things that you want to talk about that are important to you.
Yeah, sure. So most of my job, like I said earlier, has been kind of shifted over to working on the COVID response. So I haven't been able to spend as much time as I normally would on my normal EMS data manager job.
which now seems so boring.
Oh, it's totally different, right? Like
Right.
completely different.
It's like it's like Superman Clark Kent. So you like your Superman job, but like the Clark Kent's not so much. Is that fair? When he's like, he works at the newspaper, like your real job is like working at the newspaper. Like the real job is saving lives. I get you. It's funny.
Yeah, no, it's kind of cool though how we've incorporated using our pre-hospital data in the COVID response. So that's been pretty neat. So one thing that we're doing is we're tracking disposable PPE use among first responders using our pre-hospital data form. So as EMS goes out and responds to a call, they can document on their form the amount of disposable PPE that they used on a call. And then that way we can track it and use it for if we have requests that need to go to, say, FEMA for additional PPE for EMS providers in the state. Another thing that we're doing is we are using our pre-hospital form and cross-checking the names of folks that have tested positive in Vermont for COVID and seeing if they had any encounters with first responders, so EMS, fire, or police. And so our epidemiology contact tracing team is working closely with our EMS office at the health department and cross-checking to make sure that if there was an encounter between someone who was later found out to be positive with COVID, and if they had an encounter with a first responder, we're double checking to make sure that the responders were wearing the appropriate PPE for the level of care that they provided. And if they're not, then that's a whole nother story. Then we start talking about, quarantining and things like that.
So is there anything that you can share that surprised you about the data now that people are doing it? I mean, were you surprised that people even filled out the form? Were you surprised that, because no one likes to do paperwork, right? Where are the surprises? Where are the delights that you can at least share? I'm just out of curiosity.
Yeah, no. So the form that I'm referring to it's actually, we have it in our state mandate that.
Okay, got it.
Yeah, so it's an electronic pre-hospital care patient care reporting form. So anytime EMS is activated for any type of call, whether it's a 911 response or an interfacility transport or even a standby, they log into a web-based system and document that encounter. So we're able to get really interesting and good data from it because everyone in the state is using the same form, and it's very comprehensive and it's very timely, which is pretty unique. So I say it's almost real time. So we can see this data within hours of an EMS call, depending on how quickly the EMS provider enters in the patient care report. What was interesting and surprising to me was seeing the drop in call volume. So our call volume statewide decreased about, I think at the most it was about 25 to 30% less 911 calls than what we would have seen the year before. And that had a huge impact on our state system because you can't bill for calls that you don't go on. So a lot of agencies took a pretty big financial hit when they weren't going out on as many calls as they normally would. And the reason behind that was people were afraid to go to the hospital, which I thought was really interesting. And it, in hindsight, I get it, it makes sense. But at the time, I was looking at the data and wondering, like, why are we seeing such a decrease in call volume? Like, I would think that people would, I don't know.
I had another guest on that. He is in a data role at a children's hospital.
Okay.
And there was a time where they were also like a little bit fearful. It was a little bit too quiet. And then went to job security because parents were not bringing their kids to the hospital, multiple reasons. One, COVID. Two, since they're not going outside, there was no sprained ankles, sprained fingers, broken fingers. Like there is all these cascading things. So even at the child level, this is just a children's hospital where just no one was bringing kids in. No one got, so you're saying, where it's exciting that the kids are healthier, not running around, but then there's also the flip of the job security. Like, oh my God, like, well, where's our hospital going to be around if this keeps up? So you have these weird emotions.
Yeah, and on the flip side, so I think I've mentioned this before that I'm kind of in a unique position where I manage the statewide EMS data system, but I'm also an EMS provider, like outside of my normal job. So on the weekends, I run with an ambulance agency. And then when I'm at home, I'm the assistant chief of a first response squad. So I also see it firsthand as an EMS provider too. So when at the time when I was responding to these calls, at the time when there was a decrease in call volume, it was very interesting, especially and I saw it a lot with the older population, is they would tell me that they didn't want to go to the hospital because they were afraid of a COVID exposure. And what I'd explain to them is, geez, the hospital might be the safest place. Like the hospital they're on top of everything with the protocols and cleaning and everything that they're doing to ensure patient safety and healthcare provider safety. But it was really interesting.
It is nice to hear. And looking back on it, right, I'm going to share one other story that I heard. Maybe you've seen it. I'm just going to repeat the story. Flu-related deaths for children this past year, this is maybe a couple weeks ago, was one. So one child died this year of flu-related deaths versus last year, 250. So there, and again, the reason why I bring that up, and when I dug into that, it was you talking about how the process at the hospitals are very good. It's just schools are just still a petri dish. So now as kids are just staying home. Right. So these are things that things are just and this is going to be the worst flu year ever. This year is going to be a double 1-2 hit, but I don't think people took back saying, like, if no one's really in schools and no one's going out, is flu going to be that bad? I know this is a weird place to go, but I think that was a little bit of a miss, right? Because remember back then, I think it was like October, the news cycle was, wait till the flu comes, and we're expecting it to be as bad, if not worse. I don't know. Are you seeing the flu bad, or did you also see a downtick in flu coming into the hospital? Patients coming in?
I don't know. From the EMS provider side, I don't remember seeing a whole lot of influenza-like illness. What I've seen a lot of, more of an increase in, is mental health related calls. And
100%.
Mental health calls, and that's actually been a pretty big one.
Yeah.
Going a lot of calls involving mental health.
Well, even this is so relevant, and even how we started the show. We lead teams, and we're having a bad day. And I hope that, and we have a little bit more self-awareness. Now, what happens when these times are tight? I agree. It is just this is going back to why we started the show, is just to give a place where people can just maybe meet a new friend. Just now you have a new, like for me, what this gives to me, this is crazy, a fresh story to share at my dinner table tonight, because it's a new person. Where else am I meeting people? I know it sounds crazy, but now what you do today, it's another conversation, and I think these little things help me get through the day. So maybe I need this is more than you, but I want to just thank you for being on it.
Oh, yes, definitely.
And the other part is we are a community, and there's a few people in the community that are in your sector. One is actually, he's a data scientist, and I'm going to give him a quick shout out, and he's at Live Nation. And on his nights and weekends, he's helping building some ventilator splitters and some other really innovative tech. So I'm going to connect you with him. This is all about karma. And there's a passion there to just to do good. So what I'm seeing is that we've got a lot of people we know in that health space. So I'll just connect you with other people that are going through that. Misery loves company. So I think you have a lot of great shared conversation. And then if it's okay, I'll just connect you with other people. I mean, this is about, breaking up a little bit of self-isolation, and I call it the springtime.
Yeah, no, that sounds great. Sounds great.
Yeah, that's wonderful. And if you ever make it to Miami, we'll grab a drink. I don't know if I'll be in Vermont yet, but when I do, we will have a drink on your turf. Is that fair?
Well, if you come to Vermont, the best time to come, I would say, is the fall when we have foliage. It's amazing. It's incredible here.
Well, count on when I get there, I have a friend there. So that's wonderful.
Thank you.
And is there anything else before we close up that you want to give plug or shout out or anything else?
I don't think so.
All right.
No, I'm just looking.
Well, there is, we're going to try to do a monthly Q&A.
Okay.
And I might do a Q&A. Might have you maybe next month, if you've got the time, and maybe another person, because I think your Q&A is so relevant, interesting, exciting, stressing. There's not too many people I've met that have been where you are, besides people that run hospitals. So it's just, and it's not a news feed. It's just like really like, we have no agenda on this, but I think there's a lot of people that might want to ask you questions.
Yeah.
I'm fascinated. I don't wish it on anybody, but the fact that you had a playbook and you're working it is just, I still get the chills, because this is what you practice for. You never want to go live. You never want this.
Exactly. Yep. And my job a few years ago, I was an infectious disease epidemiologist for a few years. And then I transitioned into this data manager role in the EMS office. And COVID has been an incredible way to combine my infectious disease background.
Yes.
Infectious disease epi background with EMS and emergency preparedness and response. So
now I have one ask.
Okay.
It's a one ask. Okay. Are you ready for my ask?
Yeah.
When the time is right, and they ask you to update the pandemic playbook, if they do, can you make sure you footnote what you said on this call or this podcast? Footnote and say, ladies, gentlemen, what's missing in the pandemic playbook is self-care. Make sure we always stress that, because it's probably in the book somewhere, and maybe it's annotated, and make sure you take care of yourself. But you're right. Pandemics take longer to get through. Don't lose your way. I don't know where to put that. But I thought what you said was meaningful, and I think it needs to go in the 2.0 of the pandemic book that you built.
Yeah, I agree. Thanks.
And I'm happy you found your way. All right, well, it's great that we got to meet on a special day for me on a special call. So this is wonderful.
Great.
We'll connect with you on LinkedIn, as you saw, and I'll make other intros, and we'll keep the community going.
That sounds
there'll
great.
Be some other intros that we make, and just it's a good community, because we're trying to build it based on empathy and mindfulness. So everyone we're going to be speaking to skews more towards introvert empathy, introvert mindfulness. So I think you'll meet a lot of nice people.
Awesome. That sounds great.
Well, great. You got it. Have a great day.
Thanks, you too.